Good afternoon, everybody, and welcome to our Facebook Live, which is about our new patient access system, which is going to go live on the 23rd of October in Mid Sussex. I'm really excited to be joined by Dr. Ellie Flatman and Dr. Leo Sober, who are the experts. And I'm just going to try and think that. I think that was Ellie. I think so. I've muted Ellie. So we're going to. Have we got a delay? I think we have in some way. Okay. I'll carry on, and we'll probably just unmute ourselves at the moment. If not, we'll come back and come back. Okay, I'm not sure what the delay is here. Maybe it's just at our end. Okay, I'm going to get Ellie to start the presentation.
Hi everyone. Thank you for all joining us to hear about our new patient access triage system. I can see there's quite a few of you joined on live with us, and I know there'll be people looking to watch back later. First of all, I think we just want to acknowledge that the reason for this change is that we know that our current access system is not fit for purpose, and we need a change. We need a change for the patients, and we need a change for the surgeries for us to try and enable a better access to appointment systems for you. There is the ability for you to ask questions, and we'll come back to these at the end. Can we go to the next slide, Lois? Or I can do it. Sorry. Yeah, there we are. Okay, I can do it myself. So the new patient access system we're going to be using is called Rapid Health. Rapid Health will be accessed via the practice website. We'll show you whereabouts you can find that a few slides on. And it's based on a questionnaire type system. So you will log on via the website and you will fill in some questions. And the aim is that at the end of that, you will be offered an appointment directly to book, which we hope will mean that you don't need to call us and there's no need for the for the practice to call you back to book an appointment. This will be for GP appointments and our allied health professionals, such as our paramedics, our nurse practitioners. So the aim is most patients will be able to access an appointment directly after filling in the questionnaire. There will be a group of patients for various reasons at the end of the questionnaire require some more input from the practice so that the GPs can review that and determine what the best course of action is. So they will be contacted back by the practice directly, as we currently do. But most patients, hopefully, it should allow you to access appointments directly, which we hope will make the journey much better for the patients. So just to show you a little bit about what it will look like when you access Rapid Health, there's several sections that are available to you. The first section, which is what we're going to mainly talk about today, is the medical request system, which is where you will input your symptoms and answer the questions. As you can see underneath, there's an admin request box, which will be used for various different things, such as sick notes, queries about prescriptions and other admin queries. And the self-help information enables you to access NHS UK information and such the like. So Rapid Health, the online triage system, will be open from 6 a.m. to 5 p.m. on Monday to Thursday, and on Friday from 6 a.m. to 4 p.m. And I can tell that there will be people who are worried about what will happen if someone can't access this online. For example, they don't have the internet, they don't have a phone or a computer. There may be less of those on this meeting, of course, but in case you need to pass that information on to someone, reception will also be able to walk through the form with people on the telephone if they can't access it via the internet. And that will still allow patients to access the same appointments because they will be offered via the receptionist to be directly booked as well. So the system also, after you've answered your questions, which we will have a live run through shortly with regards to the actual questionnaire and how it shows to patients and what it looks like, it determines how urgent the problem is based on what questions you answer, and it will offer an appointment within the appropriate time frame. So if based on the questions you've answered, it feels that you need to be seen that day, a slot will be offered that day. If it's determined that that can wait for a period of time, a slot will be offered in the future for you to book into in an appropriate time frame. This is just the summary of the admin request buttons. So it just gives you a flavour of what the admin options are. They're very similar to those that are available on AccuRx Triage, which is the system that we currently use, which probably a lot of you have used already. I'm not going to go through the admin functions today. We're just going to mainly focus on the medical functions, but they'll be there available as well. So this is just to, hopefully you can all see that. So this is our new, recently launched swanky new website, which we hope that you all like better than the old one. On the top, you can see that says contact us online. This is currently available on the system, which is linked to our current triage system. When the new system launches, this is on the front page, and you would just have to submit that, to press on that submit a new request button, which would take you along to the Rapid Health front page. This you can access afterwards. It's just linking you to our FAQs, which we've linked on the website, and also there's a little video there by Rapid Health itself, which has just got a little video which walks through it, and then there's the link to our actual website at the end. So I'm just going to pause for a second, and I'm going to open up the actual Rapid Health page, and then we'll have a live run through. Let me just.
So apologies for the gremlins at the start. We've managed to sort that that feedback that was going on, so we should be good to go from now on.
Right. So hopefully everyone can see that page that I shared initially. So this is the live site as it would come up. So you simply go into the first button for your medical request. It's currently marketed as 16 plus. We're hoping that it will be live for under 16s by the time we open as well. So the first page, as per all these triage systems, it is just making sure you don't have anything that would require an urgent ambulance, that we would be advising you to be calling 9994. So on the proviso that none of those are present. You then have this text box where you're able to put in your symptoms. For example, we could type in various different, so I'll just do a couple of examples and then we'll go through one live. So the first one I'm just going to put, so we can put cough, and it will bring up a group of options for which you can choose as to which your symptoms would fall within. So that's cough. We can do another one, so knee pain, for example. And then I'll just do one more and we'll go through that one live. So we do sore throat. And so I've tried sore throat already. So Again, it gives you various options as to what you may wish to tick. If it doesn't have anything that you find relevant, you can tick the can't find what you're looking for button, which brings you to a different option, which can help you put in other options if you can't find what you need. So if we go for the first option and tick that, it will start taking us through what this breaks down into. And if we're happy that, you know, one of those is what we think we've got, we can move on to the next. So the first bit of information is the demographics. This is obviously not a real patient. We'll have Minnie Mouse. So you would just fill all this in with your demographics, and this will link you up with your record. It then summarises what may happen now. So you'll have different questions, and it may self-book an appointment, as we suggested. You may need to wait for the practice to contact you. It may suggest that you need A&E attention, or it may ask you to call the practice. I haven't come across any that have actually asked you to contact the practice. So we do just ask that it's filled in honestly so that the system can work properly. So you tick your box, say I understand that it will be saved, and you'll fill it in properly. And then we start our questions. I'm obviously not going to talk through every single question, but you will get the gist, and it allows you to fill in your symptoms. So we had sore throat, so we may also have various other symptoms. It asks you how long you've had it for. Have you got any of these other more serious symptoms? These types of symptoms are trying to determine whether you may require urgent attention or not. And most of them will ask you to try and determine whether you've got a temperature or not, but there is a don't know function if people are not aware, and whether the symptoms all started at the same time or not. So it just continues with some more symptoms to triage, and then a few more specific symptoms about sore throats. So we've got none of these, no eye symptoms. These symptoms are just to determine for patients who may need more serious, more urgent help because they've got a weakened immune system. COVID vaccinations, other more serious symptoms are screened for here, and we don't have any of these. And other issues that may or may not be related. So we've said we don't have any of those. So what would happen at that point is it will load available appointments in the system. At the moment, I'm assuming, Lois, this isn't going to work because we haven't got any appointments loaded in the system.
It's not live yet, so there's no appointments waiting.
So because the calendar hasn't actually been live, we can't actually show you the appointment booking screen because it would have to be loaded onto the system in the surgery. But what should happen at that point is a choice of appointment slots hopefully should come up, which will then allow you to choose where or when you want to go and what time. If there are no appointments available, or the system feels that you need some extra input from the practice, you would see this screen, which this will then be transported to the practice and triaged by one of our GP team and booked in or contacted directly. So that's a quick walkthrough through the system with regards to that. So I think we're going to leave it at that point with regards to the walkthrough and answer some questions after a bit of a whistle-stop tour.
What I was going to say, Ellie, is that we have a short video that actually shows the booking process. So what I will do is I'll share that both on YouTube and on Facebook. after this event, so everyone can watch that. It basically goes through enabling you to, it pops up with some dates. You can actually filter by where the appointment is. So it'll pop up and you can choose any of our 4 locations. So for instance, if your base location is Crawley Down, you can pick Crawley Down and only see those appointments. If you want to put, actually you don't mind where you go and you're happy to travel to East Grinstead or you're in Burgess Hill, you can then filter by those. And you can go in and out and change those filters to see which appointments are available. And if you're really keen to see a particular person, you can see if they're available as well. You can click on who and it will pop up and see the list of clinicians that those are offering those appointments. And I think it's also the questions I got asked yesterday in drop-ins was, what about telephone appointments? But I think we're actually moving more towards offering more and more face-to-face than telephone. But actually we'll have some telephone appointments available. It's only if the system decides your condition you've put in is suitable for that. And when they are shown in the appointment booking times, I'll have a little telephone symbol next to it to show that, and it will show that on confirmation. And when it gets sent, when you submit and say you're happy to book that appointment, it will send you an email. And within that email, it shows you the actual details of your appointment, but does give you the option to reschedule or cancel your appointment. If you click on reschedule, you just go back to the booking bit. You don't have to answer all the questions again. It's just the reschedule bit. So we have got some questions. So let's have a look. Questions that we've got here. So first one, a simple one, is how can I request a blood test? Does that change the system? Ellie, do you want to take that?
Yeah, so just in answer to that one, requesting a blood test, no, your blood test and most of the basic nursing appointments will still go via reception. We've had some queries about nursing appointments and whether we can start to make nursing appointments available through this system, because we know, it is a challenge sometimes to access those as well. We will be making some of the specific nursing appointments bookable through the system. For example, smear tests and some of our immunisations will also be available to book once we've started to go live, but blood tests and a lot of the basic nursing will still need to go via reception. And the reason for that is that the system is just not designed to be able to provide that function.
Yeah, so essentially, if you're looking for a nurse appointment as you would normally book, you to bring the same as you would do now, and there's no big questionnaire to answer. They will just book you an appointment that's available. That's good. Okay. What about this is hopefully an easy one to answer, Leo. How do we access the form online?
Yes, so just as Ellie said, for online users, the quickest way is to just go to our practice website. You remember at the beginning of our presentation, there's this big green banner. You can't miss it. So just click on submit a request and it will take you on to the Rapid Health page. But for those who haven't got online access, and we do recognize that there's some people that wouldn't have that, you can still call the practice and the reception will walk you through and talk you through the form online to help you submit a request.
Yeah, so that kind of answers the next question. Are you saying we don't ring in to fix an appointment time? So if you can access the internet, then it'd be great. As many people can do that themselves, they'll get the best information and they can do it themselves online, and you'll be offered some appointment at the end. If there's not, if your condition needs GP review, it'll be put through to GP review and then we will contact you. But if you can't use the internet, then please still phone us. They will go through the same questions with you over the phone, but essentially that they will then offer you an appointment time over the phone as normal, but it's all done based on medical need. Okay, can I make appointments on behalf of family members? That's a good question. Ellie?
So I would say, well, yes, you can walk through the form with your family member. The questions are obviously quite detailed, so you will probably need to either be with your family member or helping your family member to fill in the questionnaire. But certainly, I think, I've certainly helped my grandmother with one of these very similar questionnaires through her own practice. So I think, yes, you can certainly do it for your family members. I think the only thing to be mindful of is obviously the details you're inputting with regards to email addresses and telephone numbers won't be transmitted onto her records, but the confirmations or his records would be that's where the confirmations for the appointments and things would go to. So it's just being mindful of that, really. But I think, yeah, you can help people people through the form, but you probably need them with you to answer all the questions, or on the phone or some format.
Thanks, Ellie. So when an appointment is made, is it any practice, or if you need to go to what happens if you need to go to your nearest practice? Leo, you can answer that, can't you?
Yeah. So so when you fill the Rapid Health questionnaire, right at the end, where it takes you to the video that Lois, you're going to be sharing later, you've got a drop-down filter which has got all of our 4 practices, so you can sort of flicking through the filters to choose. So all the appointments available on our site will be visible to you, so you can choose the site or the doctor that you want.
If they're available.
Yeah.
Yes, if
Is
they're
it worth
available.
also
I think it's what
saying-
I think is what noting that if you want an acute urgent appointment on the day, then obviously you've got more limited options. But if you want routine appointments, then there are more options available at different sites. I don't know if that's what you wanted to mention, Ellie.
No, and well, yes, and I was just going to say also, we do recognise that there are some patients that may not be able to. So you may get through the system, and you may only be offered an appointment at Crawley Down through the system, and you can't, you're unable to drive or travel, and we are aware of that. Hopefully, most patients will be able to access appointments or travel to sites as per needed, but I think we do recognise that we may have to help with some of those through reception if needed, but hopefully for most patients it will make things more accessible.
Easier.
Okay, that's good. So this system avoids the wait hanging on the phone. However, will there be more appointments available, and if so, how many? I don't even quote how many exactly, but otherwise it's just a quick way of finding out that there's no appointments. It's a good question. So, Ellie, do you want to say about how many appointments? Not exactly,
Yeah.
but
so some of you may have already been party to this information, and different communications have gone out about our recent recruitment. We have over the probably last 6 months employed 10 new doctors. Would you say, Leo? It's probably about 10 now in total, or 10 coming by the end of
9, but 10 coming by the end of the year.
Yeah. So we are offering more appointments, and we've got new staff, new nurse practitioners joining us. So there are definitely more appointments available. How many more, I can't tell you, because that's a figure I don't have off the top of my head. We hope that there has been some improvement in access already, but I know that the access is definitely not perfect. But we hope that being able to triage things a bit more accurately and moving patients into the right slots with the right person at the right time will also help us to use the appointments we have effectively for the patients who need them. So we are hoping that we won't be having to turn as many patients away as we are, and that we're not sending people off to the urgent treatment centre as much, because we will have a more accurate based triage system. Because as you know, at the moment it's a little bit of a bun fight who gets in the front of the queue and who doesn't. We want to try and get rid of that, really. So hopefully we've been very successful in recruiting. We've got a lot more regular staff working with us rather than locums, which also is much better for you as the patients, because they're people who know how we work, know how the systems work, and will be working with us to make this work. So fingers crossed.
Yeah, and I suppose I think it's also worth mentioning, I mean, in terms of data and numbers, we can definitely say in terms of our capacity, compared to this time last year, we've increased our capacity by at least 40% in terms of the number of appointments. I know that, patients might not feel that, and, this is why we're introducing this system to, increase capacity and obviously, increase capacity and make it equitable, as Ellie said, so that it's not that first come first serve in the morning. Spread it across the weeks, and then make it easily accessible for patients.
That's good. So we've had a few questions, so people have joined late. So welcome anyone who's joined later than the start. You can obviously watch the beginning part back again if you want to, about when exactly the system goes live, and it's Wednesday the 23rd of October. So it's only in a couple of weeks' time that the system goes live. On our website, you'll be able to access it from there. So good question is about asthma reviews and I think all long-term condition reviews. How will they be booked? Will they still go through reception?
So just as Ellie said, at the moment the Rapid Health bookings are just for GP clinical appointments and allied health professionals. So your diabetes review and your chronic asthma COPD reviews will still have to go through reception to be booked with the nurses.
Yeah, that's brilliant. Thank you. So someone's asked a really good question. I got asked this a few of our patient engagement sessions about the Voice Connect telephone ordering system, and there's patient access and NHS app for people ordering their repeat prescriptions. And we can reassure that that doesn't change. That's the best ways you can order your repeat prescription. So please continue to use that method. This is just for medical requests. There is a bit about putting prescriptions in, but actually the NHS app, patient access or Voice Connect are the most efficient and best way for patients to order their repeat prescriptions. So please carry on using that. Another good question: what happens if the system goes down?
Well, so some of you will obviously be aware of our system down event that happened maybe, I don't even know how long ago it was now, a couple of months ago, wasn't it, where the whole EMIS computer system went down, which meant that we basically couldn't see any patients because we had access to any notes. Interestingly, practices that were running with Rapid Health at that point were actually able to still continue to function because they actually worked via the Rapid Health information in the system. So if the system goes down, well, we'd have to revert back to old practice and phone the surgery to book appointments, wouldn't we? I would really hope that Rapid Health and EMIS didn't go down on the same day. If they did, well, we wouldn't be able to see any patients safely, but fingers crossed that won't happen.
I think also it's worth noting that it's a very secure Rapid Health. It's NHS approved, and also it is web-based, so that the risk of it going down is much less likely than the client-based systems like EMIS that we use. So yes, I think it goes back to pen and paper. I think when we lose the internet for everything in life. Yeah. Okay. Will an appointment or way forward always be given as opposed to response to say that we're all full, please try again?
Right. We would hope that there will be less of that. As we said, we have, doubled appointments over 6 months, but it's not quite feeling like that because everybody wants to be booked in on the same day. So what we're trying to do is spread capacity over a 3 to 4 week period so that we can then offer more and then obviously offer it to people when they need it appropriately. So obviously I can't say no to that question, but we're hoping that there'll be less of that.
Yeah. I think it's worth saying that actually. Yeah, so we've been trying to, the system that's been operating is trying to book everybody into the same day, whether they're routine or needed. And actually the number of people that actually need seeing urgently the same day in a GP practice is really quite small. Yeah. And actually most people would like to be seen within 3 or 14 days of contacting it. So there's a time and location that's more convenient to them. And so in doing that and spreading that capacity going forwards, it means we're not always trying to cram everybody into the same day and then we fail every day at doing that. So it has been used elsewhere. In East Surrey's gone live in our practice on the 1st of July. Our Birmingham practice are going live the past 2 weeks and across a few more weeks. And it's been used by other GP practices in the country, non-modality ones, and they've had some really good results with that. It's not going to be perfect because unfortunately primary care isn't perfect and there is an infinite amount of appointments, but we do think this will be much fairer access for patients going forward.
Yeah.
So there's a bit interesting question. Is the software the same company has created Royal Mail system? Reason being is it mainly wondering how safe the patient data is. That's a really good question. So it's definitely not Horizon. However, it has been through a very rigorous medical device process registration and is approved by the NHS. So I can reassure, and there is information available online if you look for it for Rapid Health and that, but just to reassure that it is very secure in retaining patient data. Well, it doesn't retain patient data, it just passes it to the clinical system. If you have an appointment booked in a few weeks but deteriorate and need to be seen sooner, what do you do? Good question. Leo, do you want to take that?
Yes. So if you do, then the option will be to go back to Rapid Health and then put in a new request, which will then triage it to a much more urgent appointment for you.
Good, excellent. In the past, appointments have only been offered on the day. How far ahead will the appointments be available on this system? So, Ellie, do you want to answer that?
So we obviously have had some appointments available in the future, but they go like hotcakes, and it doesn't often appear to patients that we do have any future appointments available. The plan is that we will have appointments available up to 4 weeks in advance.
Excellent. But I suppose it's worth pointing out if you're triaged by the system as needing one within 7 days or within 14 days, it only show you those appointments within 7 days or
Up until-
3 days, won't it? Yeah.
Yeah.
And actually, a good point. I was speaking to someone about rescheduling. So if you decide, if you within 7 days and you decide day 6 you want to reschedule it, it's only going to show you the one day.
One for the next day.
Yeah.
Please contact us on the phone if you need to reschedule at that point. But it's because we think you need to be seen within that time frame. Another good question: what do people do if they suffer from dyslexia? A good question. I've got an answer, but I'm going to test the doctors to see if they can.
Ellie, that's your question.
Well, I would say for anybody who is finding the form challenging, that you can still access our reception team who can walk you through that form.
That's the best.
And enable you if you're finding the form difficult. I suppose there may be some different needs for different people who find it difficult. Some people may find it more accessible than being on the phone. Some people also don't like telephone calling the practice either and find that very stressful. So, but we have got both options still available. It just will be that we are hoping that most people can use the online form, because then that will allow our reception staff to spend time working through the form. Because as you can imagine, the form, if you had to ask every single question to a patient, could take quite a long time. So we're aiming to try and move most of it online, so our reception staff can dedicate it to the people who do have access needs or find it difficult to access.
That's excellent. Extra answer as well. Actually, I'm not a brilliant speller, and the Rapid Health is very clever. If you spell it, and even if it looks sort of like the word, it will make a really good guess, and it's normally always right that then shows you the right options. So if you're struggling and in that you think that might be a barrier, try it. I would have a go at first if you're happy with using the internet. But like Ellie says, the phone is always there for us to answer for you, to do it for you. Good question. Will I still be able to use the NHS app for ordering repeat prescriptions? Yes, please do. Excellent. Do a little plug for the NHS app. It's brilliant. The NHS app. You can see your test results, see your consultations, order your repeat prescriptions. So, and actually, in the future, Rapid Health will be embedded within the NHS app for our patients. That's coming soon. So please do carry on using the NHS app for that. I like this. Can the negative "we've got no appointments" message be taken on the phone system? It's going. We are very soon launching with all the Rapid Health information and new phone messaging, and that no appointments message will disappear forevermore, hopefully. That's good. Are all appointments in person, or will some be using a virtual online appointment?
Okay. Do you want me to answer that? Yes. So what we're can you hear me? So what we're with the Rapid Health system, we're actually moving more on towards face-to-face appointments. However, a lot of the slots have been triaged to both face-to-face and telephone, depending on what patients need. But if you want a telephone appointment, you'll always be given that option. And I think at the end of the form, if for the telephone appointments, there's like a telephone button which tells you whether it's a telephone appointment, but you'll be given both. But generally speaking, we're moving more towards offering more face-to-face appointments.
Yes. Yeah. So we found that actually, if you offer too many telephone appointments, GPs will speak or clinicians will speak to people on the phone and they'll bring them down anyway, when actually we could have just seen them and saved another appointment for someone else. So we're definitely moving the way. So at the moment, I think I've been scanning up and down. We've got many more questions left. So if you've got questions you would like to ask us about the new system, please just put them in the chat. We're happy to answer them. Here we go. So non-urgent appointments need to be done in person, as otherwise the system is not going to recognise the call. Oh, it's jumped up. Hang on a minute. Recognise the call as being an appointment. So non-urgent appointments need to be done in person, as otherwise the system is not going to recognise the. I don't quite understand that.
So all appointments will go through Rapid Health, urgent or routine. So you should be able to find, okay, the conditions I possibly put in were more urgent, but not necessarily. Knee pain may be non-urgent. So everything should be going through Rapid Health if you want an appointment, basically. You should be able to find whatever you feel is your issue.
So essentially, it's if you think you need a consultation or some kind of diagnosis with a GP or advanced clinical practitioner, advanced allied health professional, it goes through this way. If you're looking for a nurse appointment, and you still phone us and we book a nurse appointment. So anything that needs that kind of consultation. Okay, I'm going to star a few of these so I don't lose them. How can we be confident, as it's only the system that reviews all the answers, as opposed to the current triage request being looked at initially by a human medical professional, that the right decision outcome will be given by the system? Good question. Ellie?
So I think one of the reasons that we actually chose to use Rapid Health is actually its patient safety data is actually safer than a human. So although you put a lot of faith into us as clinicians, we all make different decisions, and we all make different decisions based on various different factors. So this algorithm has been designed as a medical device, which is what Lois said, and medical devices require huge amounts of patient safety testing, which is why we have actually gone for this system. The reason that some of the conditions are obviously not able to be auto-booked is because the system cannot be sure that those do not require a set of, experienced eyes to decide whether that's that they, not quite sure what to do with them, or that, it feels that you need a different decision to what the algorithm feels. Sorry, I'm rambling slightly, but I think you can be reassured that the safety of the system has been vigorously tested, and actually that's why we've ended up choosing it. And a fatigued, tired GP who's already triaged 150 patients is not going to make a decision as safely as this. So you can be reassured.
Yeah, I would completely agree with Ellie. And actually, I haven't looked at some of the questions, and the way Rapid Health makes its decision is actually more likely to err on the side of caution. So actually, if it's not sure, then what would then happen is that it would then end up in a duty box where a GP can then actually triage it. So actually, it errs more on the side of caution more than the GP triaging it.
I need to say sorry to Carol because I didn't ignore your question. Thank you for asking it again. So it's asked a question about how many full-time equivalent GPs will be serving us from this point forward. So I think I can't give you an out-and-out figure, but in terms of, we have recruited a lot of permanent GPs, but we still are using some locums as well, and we will be probably doing some more recruitment going forward, and also some advanced nurse practitioners, paramedics, other types of clinicians. So I can give you a stat that in June 23 we're offering 8,500 appointments a month. Now on average we're offering 15,000 appointments a month. Yeah. The difference, you probably don't feel it yet, is because at the moment you're still ringing at 8:30 and we're still trying to cram you all into one day, and we're getting to the point where we're running out of appointments for that day. This system is meant to spread the demand across our capacity to make sure we can see those with an urgent need that day, and those who can have a routine appointment within a tight, safe time frame can be offered that. I hope that helps answer your question. So a good question. I think this one's about, they're saying their daughter needed Seracream, they sent a photo and it was reviewed, and then a prescription was done. At the moment, you can't upload a photo in Rapid Health, but it is coming, isn't that right, Ellie?
Yeah, hopefully. And some of these ones, so for example, often rashes are a problem in children, aren't they? The under 16s, even if they go through Rapid Health, children will all be coming to a GP for triage. That kind of slightly goes back to the safety question, because kids are high risk. So in these cases, we may still use the system that we used with you, where we may text you and ask you for a photo, and it would still continue the same way. For adults, some of the dermatology ones may come for triage, may not. I don't know, because we haven't obviously tried all of the specific functions, but it doesn't have a photo option inside Rapid Health, but we will still use the photo option inside the practice if appropriate, if that makes sense.
That's good. Thank you. Another one about ordering a repeat prescription. So you can send a repeat prescription request through Rapid Health, but we would probably encourage you, the best way to do it is NHS app, patient access, or you can use the telephone automated system, Voice Connect. And if you've got any queries about that, there's information on the modalitymidsussex.co.uk website, or you can speak to a member of the team. So it feels like with this system, there could be appointments not used, i.e. urgent on the day. If 10 appointments, we know exactly what you're saying. Ellie can answer this about East Surrey, I think we have experience.
Yeah, so there is a possibility that this could happen. I think it's highly unlikely to happen because there are always things internally that require those appointments to be used. You know, whether that's somebody who needs a call for an X-ray result, you know, things that wouldn't necessarily come via Rapid Health, because we will still have all those things that still need dealing with. So I think it's highly unlikely that there will be wasted appointments. They may just be used internally in a different way, is what I would say. And of course, we will also still have the internal triage box. And I would say, well, I certainly will be keeping a close eye on the usage of appointments and making sure they're not wasted. So, you know, that's, I think, unlikely to happen. But I can completely see what you're saying.
Yeah. And I think also, I suppose, as we learn, as we're using it from our side, if we find that that balance is continually not quite right, we'll
tweak it.
Appointments that are urgent and some that are routine on the same day as well. A quick question about clarification about how someone would book a shingles vaccination or something like that using this.
So again, this will go over the reception, because obviously it's a nursing appointment. So telephone the surgery as you would normally do to book it via reception.
At the moment.
Yeah, at the moment.
At the moment, yeah.
Yeah, so it will be going live specifically through Rapid Health. So, but there will be an option on the website for you to tick for shingles vaccination, and it would go through a separate set of questions that will check your eligibility for this shingles vaccination and allow you to book into a specific appointment type for that injection. So that will be going live too.
It's a good question here from Caroline. Will the same criteria for priority of condition patients still apply, the vulnerable sort of listing, those with asthma, etc., over 75s, that kind of stuff?
So I suppose it depends in what format you mean. So Rapid Health will also, you know, will have determined the vulnerable list, as you say, because it will have asked you all those types of questions within the questionnaire. So that will determine the urgency, which I assume that the algorithm will pick up the people who are vulnerable, which may or may not be the categories that we've previously selected, depending on what it determines. What I would say is the stuff coming through for manual triage, we will obviously still be picking up the high-risk patients because we'll be looking at them in the same way that we would normally be looking at them. So we would be triaging vulnerable patients above others, if that makes sense.
Yeah, that's good. Thank you. Really nice comment from Jill. Thank you for that. We'll be sending out via email and text the website link so that everyone knows the link before we go live, so that everyone's got that. But again, just to reiterate, if people could go to modalitymidsussex.co.uk, or you could even put Modality Mid Sussex in Google and it comes top. The link will be really obvious and a green banner on there once we go live. A question about, do I use the system if either of my two children need medical advice? Ellie?
Well,
go
on. I was just going to go after Ellie. No, if they're under the age of 16, at the moment, it doesn't let you do that. So under the age of 16, you use the system, but it doesn't give you an automatic appointment. It comes through to an inbox where the duty doctor on the day then triages. We're hoping that at some point it will let you book automatically. I don't know, how soon is that happening, Ellie?
No, so that's not quite right. So so at the moment, the system is only functioning for over 16s. The rollout from Rapid Health of under 16s should be live by the 23rd. So
that's what I meant.
Children will never be auto booked. So children will always be triaged because of the high risk, nature of looking after a child. So at the moment, the medical devices license is unable to let them do children. So you would still fill in the questionnaire, and the questionnaire will come to the GP to book the appointment, triage it, phone you back as per for safety reasons, basically.
Yeah. So just so I understand, you fill it in, and then it comes to the screen. It basically says the contact practice will contact you, and that will go straight to a GP who will review it and then contact you with the appropriate care.
Yeah. So for the children, is it from 1 to 5? Is that the difference then?
No, everyone under 16. Everybody under 16.
Yeah. Yes.
We're educating Leo today as well.
The children bit is very hot off the press. So the children bit is going to be a new service that's going to be rolled out by Rapid Health, and will be one of the first practices, fingers crossed, to be testing it. So The auto book may come for some conditions later on, but I think for now it needs to be triaged by a doctor.
Yes, good. Just to clarify, again, I think I've probably confused people about the differences between patient access, NHS app, and all of that. So at the moment, we currently have a system, the online consultation, which is called Patient Triage, and that will be replaced by Rapid Health. However, the other systems, like where you can access your repeat prescriptions or your notes or your test results, like Patient Access, NHS app, and Voice Connect, still remain. So if you're used to signing on to Patient Access to do your repeat prescriptions or any of those kind of functions, that stays exactly the same. Will appointment reminders be sent out the way they are now for, say, vaccinations? Leo?
So can you read the question again? Sorry.
Will appointment reminders still be sent out? I'm going to say yes, they will, exactly the same.
The way they are. No, sorry, I didn't hear that. Sorry.
That's okay, that's fine. Right, let's skim down questions. Oh, again, someone again has asked about how will I get results? Oh, no, actually, I haven't answered this question. How will I get results of blood tests?
So it's still going to be, yeah. So it's
on your
still going to
NHS
be,
app is the best way.
Yeah, exactly. Yeah, it's not going to be via Rapid Health. So I would encourage you to obviously call in for your blood results appointment, or you can just check via the NHS app. That's the quickest way, really.
Yeah.
Or there is the admin function for results.
Yeah.
Although it's not going to necessarily, it doesn't allow you to auto see them. So if you went onto the admin function and asked about your results, we would have to send you them or tell you how to access them. So it's not going to allow you to access them through Rapid Health. So in the same way you do now, really.
Yeah. So NHS app still the best option.
Yeah. Is it worth saying a bit about while we're on the sort of test results that actually, if they're normal, we won't routinely contact you, but if they're abnormal or some action that is following, then we will contact you within that time frame. Is that correct?
That's correct. Yes.
Yeah. Good. I've got a good question. I hope that's not happened. God, that's the question. Oh, yes, I'm late. Can I view this again later? Yes. Once we finish being live, it'll be available on YouTube and Facebook in the video sections or the live sections on YouTube, and you can watch it again. It'll also be named in the feed. How will the systems work with a child over 16, adult with no capacity? Good question. Ellie?
That is a good question. So I would say it will work in the same way that you're able to book an appointment currently. So as we said for somebody else who said, can I fill it in for a relative? I know Catherine, so I know what she might be talking about. And I think it's entirely appropriate for people to have filled in the questionnaire for a relative. As we said, the questionnaire can be accessed directly via the website as long as you've got the patient's details to fill in, and then that would you'd be able to book an appointment as per usual. I suppose the only internal issue, which is the same one that you normally have, is when you speak to the doctor or see the doctor, they're going to need to make sure that the person making the decisions or discussions is obviously able to share information, but that doesn't really affect the person inputting the information in the beginning.
Good. Excellent. Thank you. So someone's asked a question, a bit related to what we were talking about. How will you contact a patient if their blood tests are abnormal? What methods do you use to try and contact a patient?
So there are different methods. It depends on the GP that's seen you. So a GP may send you a message via our AcuRx system. The GP may get the receptionist to actually call you and contact you, to book an appointment as a follow-up with the GP.
Or we may send you text or something like that.
Yeah. On the AcuRx, yeah.
If you've got a mobile phone that can do that. Yeah, excellent. So how far ahead will appointments be available?
4 weeks.
4 weeks.
4 weeks. And who do we approach if results do not appear on the NHS app after 7 days? Because they don't appear until the GP's reviewed them, do they?
No.
Reception.
It also depends what type of result, isn't it? So if it's a blood test result, I'd either put an admin request through Rapid Health or I telephone the practice to check what's happened to your result. If it's a different type of result, like an X-ray or an MRI, that's longer, right? I think.
So they're saying it may take 4 to 6 weeks now for X-ray results to be returned to the practice. Yeah.
Wow.
But I think, if it is urgent, I think just to reassure patients, if it is urgent, they're quite quick in emailing or texting the practice within 24 hours. So in theory, if you haven't heard, then it's likely that it is anything urgent. But yes, it can take up to that long.
Okay, excellent. So I haven't got any more questions, I don't think, to answer at the moment. Is there anything else, Ellie and Leo, in case we've got a bit more, 5 minutes or so to answer questions that come in? Is there anything else you think we haven't covered that might be important to cover?
No, I think hopefully we've summarised everything, and we appreciate everyone's support with the change and bearing with our staff as well, because it is obviously a big change, especially for our reception staff to be helping people through these forms and things, and us all getting used to a new system. But we're hopeful that it will be better than the current system and more accessible and more fair. So fingers crossed that we'll be.
Yeah. It's worth pointing out, isn't it, that actually we have staffed ourselves with extra locums for the launch, pre-launch, and post-launch, and also we are having additional people answering the phones to our team for at least 6 weeks post the launch to try and make sure we can keep that call. It's good. I have got a question. What is happening to medication reviews? Will this happen when you get a notification on your repeat script request note? So what happens? Nothing changes, I think. It's exactly
not from this
right,
system. Nothing changes with this system.
So
So if you need a medication review, still telephone us and book that with the pharmacist and the pharmacy team. That's good. Any more questions? Last call for questions online before we start closing up. But it's been some really good questions. If you can book 4 weeks ahead, does that roll forward each week? Yeah, each week.
Yes.
The week forward.
Correct.
Yes. Exactly. Yeah. Keeps on going. Yes. Someone did say, why only 4 weeks? And I think it's because actually a lot can happen in 4 weeks. And actually we find if we book patients too far in advance, we get a lot of people who don't turn up to those kind of appointments.
Or they've already been to see somebody and they forgot to cancel the other one. And also it's for staffing levels, because we are sometimes allowed to have a day off or holiday. If you've already booked all the clinics, that's just annoying for everyone to rearrange as well.
Good. Excellent. Someone's put a point about, thank you for the communicating this way. We actually have, and what about people who can't on Facebook or YouTube? Really good point. I've just been down in Mid Sussex doing 3 days. We did some really great sessions with patients in Burgess Hill at East Grinstead and in Crawley Down. We had, I think, over 700 plus patients came to see us. We had to walk them through the system in groups and ask them some really good questions. We have got frequently asked questions which are available printed out in practice. They're available on the website. And we want patients to feed into that, because then we can improve those questions. We're going to do some little how-to videos as well, which will be coming out as we go live. And so that anyway, if you think there's a better way, we could reach out to people. We're open to that. We will try where possible to try and share information far and wide, because we want as many people to know. I should say also the phone system messaging will be changing imminently to tell patients about the change as well.
Good question to say as well. There is obviously the FAQs and info on the website as well, which we shared. I know it was on the front slide, but it's also on the website, which people can find. I know if you're not online, you can't find the website, but and there are printouts and bits and pieces in the surgery. Yeah,
get a copy in practice. As one last question about cancelling or amending your appointments. So when you go through the auto book system, or if you've been booked by practice, you will get an email that says that confirms your appointment, and there'll be a link to say reschedule or cancel. So obviously cancel does cancel the appointment. Reschedule will just take you back through to just the booking part about the dates and offering you different appointment times. There you go. What happens if we ask to book a follow-up appointment? That's a good question we haven't covered.
Probably last.
Really good question. So every GP will still have what we call follow-up slots. So they will be able to book their own follow-up appointment when you see them. So if a GP feels that you need to be followed up, then they should be able to book you in on that day before you leave the surgery. However, if it's a case of, see how you get on and, contact us back if you're not any better, then that comes in back through the Rapid Health system.
That's great. And someone's asked a question, I think nearly our last question we'll have to take is, will it be possible to see the same doctor in subsequent appointments? So Rapid Health does allow you to look at the available appointments and see who is offering those appointments. So if there's a particular doctor, but as Leo said, if you're seeing someone for a particular condition and you need a follow-up appointment, that doctor should book that for you. It's good. And no, you won't get cancelled. You won't make coded as did not attend if you cancel your appointment. Okay, it's been a really, really useful session. Thank you so much to everyone who has joined. I think it's been really good. But we are going to be doing again. If we're glutton for punishment and you want to see us again, we're available on Wednesday night next week at 6:30. We'll be doing the same thing on YouTube and Facebook. Please tell people to watch. Also, this session is available and now as soon as we finish on Facebook and on our Modality Partnership YouTube page on the live section. Please, if you've joined late, you can watch back again from the beginning, or anyone you know that might want to find out about this, please share and let them know. And if not, we shall see some of you maybe again next week. So again, thank you for all your support and all your questions, been super useful, and we'll see you all next time. Thanks.
Thank you for your time.
Bye.
Bye.